Hi, my name is Hector Duran, student of Ottawa University for the Training and Development HRC 7601 class dated for April 11th, 2020. This is my presentation on effective communication for the behavioral health technician professional. Just to kind of get things started, in regards to pursuing a career in case management, there's one thing that needs to be understood is that your role is always going to have some idea in which communication is vital. This presentation is pretty much going to dictate a lot of this information so that you become aware as to what your role in all this is and how to effectively communicate in varying instances, in regards to when you're meeting with stakeholders in the community, when you're coordinating care in the community for the members that you're serving, in your emails, how you're communicating various instances of crisis in which a member is requiring some sort of immediate assistance. So just so that you're all aware, this component of communication and this module is just going to pretty much touch on some of these instances in which communication is very much important in your everyday work life. You will be receiving, I just want to caution everyone, you will be receiving additional training on a lot of these areas, but I just want to make you guys aware specifically on how communication for the BHT professional and the basics and foundation for it. So first of all, I want to start with the first slide, and that's defining communication. What is communication? According to Merriam-Webster dictionary, it's a process by which information is exchanged between individuals through a common system of symbols, signs, or behavior, or exchange of information. I mean, this is pretty simple. Most of you guys are pretty much aware, whether you've completed college classes or you have been in the system, you guys know that communication is not very complex. There's a listener and there is a communicator. There's a speaker and there's a receiver. So at all times, in all facets and in all instances, you will be required to somehow provide a form of communication. Now, for the behavioral health technician, one thing that's important is understanding that there are 4 types of communication in general. The first is verbal. Verbal communication is the use of language to transfer information through speaking or sign language. Nonverbal communication is basically the posturing, the body language, the things that are not said. And written is another form of communication, as is visual. This can vary from each individual encounter, and with varying individuals you'll be working with throughout your experience. From the prescriber to the nurse, which is made up of the medical team, to your supervisors, and even the members you serve, communication will vary. This training is just to provide you some perspective of this varied communication that's going to take place. Verbal communication for the BHT is very vital. So I want to really catch on some important terms. The first is active listening. And active listening is a technique that is used in counseling, training, and solving disputes or conflicts. It requires that the listener fully concentrate, understand, respond, and then remember what is being said. This is opposed to other listening techniques like reflective listening and empathic listening. I'm going to go into detail in those areas as well. Active listening does not necessarily mean a long session spent listening to grievances, personal or otherwise. It's a simple way of approaching these problems which arise out of usual day-to-day events of any job or any situation that occurs with the member. To be effective, active listening must be firmly grounded in the basic attitudes of the user. We cannot employ it as a technique if our fundamental attitudes are in conflict with its basic concepts. If we try, our behavior will be empty and sterile, and our associates will be quick to recognize this. Until we can demonstrate a spirit which genuinely respects the potential worth of the individual, which considers his sights and trusts his capacity for self-direction, we cannot begin to be effective listeners. You're going to hear this term used a lot from me, and that is the term of being mindful or mindfulness. And that's basically, and we're going to go into further detail as to what mindfulness really means, but it's basically being in the present. It's being in the knowing of information that is being shared, and that you're you're not listening for the purpose to just merely respond, but you're actually listening and you're taking in the information. For active listening, it really takes an individual to be able to sit there and really just be at one with the member that you're working with, especially in instances where they're in a crisis, in a behavioral health crisis, and they find themselves wanting to hurt themselves, or are reporting to you that they're having homicidal thoughts in which they want to hurt others. Or even just listening to some of the small details of their information. Active listening is pretty much a requirement in our role as case managers, because you're constantly going to be inundated with information with the members that are giving you insight into what's going on in their everyday life. So with that said, it's imperative that you really take time to evaluate and put your judgments to the side. And this is, you're going to find that even in all other areas of listening specifically, that it really takes an individual to be able to put your prejudices to the side and your preconceived notions, and really allow yourself to just listen to that individual and be able to take on their information and see how you can then take that information and do with it what is necessary for the member. The next portion of verbal communication is reflective listening. It's a communication strategy involving two key concepts: seeking to understand a speaker's idea and then offering the idea back to the speaker to confirm that the idea has been understood correctly. Reflective listening is a communication strategy involving two key steps. Again, seeking to understand the speaker's idea and then offering it back to the speaker so that the speaker knows that you understood them correctly. Summarizing what the speaker said using the listener's own words. This is different than paraphrasing, where words and phrases are moved around and replaced to mirror what the speaker said. The reflective listener recaps the message using his own words. There's another component that we're going to go on into, because I know many of you are probably listening to this, and many of you that have been in the field have probably heard reflection as part of a concept for motivational interviewing. And that is, and then that's a key concept that we're also going to kind of target in effective communication is the element of the utilization of motivational interviewing, and being able to reflect what exactly the member is telling you as you're receiving the information, so that it's not distorted, so that it's completely understood. So again, ideally, reflective listening encompasses these two factors. Taking in the information and then offering it back in a way that the member feels that you completely understand their point of view. Next is empathic listening. It's paying attention to another person with empathy, identification, compassion, feeling. One basic principle is to seek to understand before being understood. Through empathic listening, the listener lets the speaker know, I understand your problem and how you feel about it, and I'm interested in what you're saying, and I'm not judging you. Amongst the benefits of empathic listening is among the benefits of empathic listening is it builds trust and respect. That's something that a lot of times for our members is very vital, especially when working in the mental health field. They want to know that the person that they're speaking to is someone that they can genuinely confide in. Now, there is going to be some information, and again, we're going to go into it, not so much into detail today, but we are going to touch about some of these elements. But there are crisis situations in which you will be asked to really gauge the member and find out where they are presently in their life, and for purposes of petitioning, whether they're a danger to self or others. And you're going to hear these terms a lot more throughout this training. But again, there's going to be times where you're listening to the member and your red flags are immediately going to start coming up. The important part of empathic listening is basically to be able to stay in that moment and build that trust with the member. It also allows them an opportunity to release their emotions, even though they may be telling you, I want to kill somebody or I really want to hurt myself. At that point, you need to allow them the opportunity in which to vent this idea to vent this notion, so that then you can go back, and through reflective listening and even the active listening, utilizing all these three different components all at once, be able to then redirect that member's behavior, because chances are that the member is just feeling that emotion and they're guided by the response of that emotion, because they have no one to speak to about this emotion. It's when individuals are not able to be redirected that then you have to really look at that and ask yourself, is this an opportune time for us to look at the possibilities of filing a court order petition? Again, we will go through that process here for effective communication in a later slide. And we also will be providing specific training as far as what entails court order treatment, evaluations, crisis redirection, crisis assessment, and things of that nature throughout your modules while in training. Another component that it builds is it encourages the surfacing of information. It allows that individual sometimes to process that information and really, dig deep as to where this information is really coming from, these emotional responses are coming from. And also creates a safe environment that's conducive to collaborative problem solving. And again, for a lot of our members that we work with in the field, you're going to find that they just want to tell their story. And that's the important part that we as case managers play in working with individuals with mental illness, is providing them validation and giving them that opportunity in which to speak their mind, in which to speak their emotions, and then teaching them. That's the component of case management that's often missed. And this is why I love this field so much and working in direct care, and why I felt it very necessary to develop training to help case managers really grasp that. Because it's very important that the member is very much supported throughout the whole process, that they're being validated, that they're being listened to, that their story matters to someone. And oftentimes when they get that, they find that these emotional responses are unnecessary. And it finally leads to that opportunity to teach them how to change their ways and how to reprocess these emotions. And again, it's a great experience. And when you see individuals who you're working with learn through some of their own experiences and utilizing some of the tools that you're offering them, it can be one of the most beautiful things to see an individual. It's almost like watching them heal right in front of you. It's like seeing that light bulb just go off up, above their brain. And they're like, wow, I get it. I truly get it. Another vital component of verbal communication within our field is workplace listening. Workplace listening is a type of active listening that is generally employed in a professional environment. Listening skills are imperative for career success, organizational effectiveness, and worker satisfaction. Workplace listening includes understanding the listening process, i.e. perception, interpretation, evaluation, and action, and its barrier that hampers the flow of that process. Like other skills, there are specific techniques for improving workplace listening effectiveness. Moreover, it is imperative to become aware of the role of nonverbal prompts in communicating in the workplace, as understanding messages wholly entails more than just simple verbal messages. I bring this to our attention because oftentimes in case management, we're brought into these training processes, and a lot of the training that is provided is specific to either case management or specific to human resources, if you will. My plan here is to teach you guys that we have to be, again, mindful, and I'm going to continue utilizing this word. We have to be mindful of our environments, and whether it's working with a member or it's working with a coworker, colleague, behavioral health, medical professional, nurses, doctors, what have you. We have to understand what it is that A, we are hearing, and then B, what we're sharing in regards to that information. You all will have the basic responsibility of communicating a wealth of information to your BHMPs, your behavioral health medical professionals, which are the doctors and the nurses. Oftentimes, you're going to be reporting back indicating that the members are reporting symptoms or side effects of certain medications that they're taking. One side effect of for instance, a psychotic medication, antipsychotic medication, is tardive dyskinesia, in which there's abnormal jaw movements or locking of the joints. It's imperative that if you don't know what tardive dyskinesia is, it's okay. You don't need to know the term tardive dyskinesia. But if a member is coming to you and saying, I feel like my joints are locking in place, or you're engaged in dialogue with them, and all of a sudden you're seeing this abnormal jaw movement as they're speaking, or clenching of the jaw or tightening of the jaw, it's imperative that you then communicate that information directly to the providers, because it can be very uncomfortable, and the member may or may not be aware of it. But again, you have to put yourself in their shoes and ask yourself how you would feel if you were having these clenching or locking of your joints. It would be quite uncomfortable. So again, it's imperative that from this perspective, when we're looking at effective communication, we're looking at listening and communicating modules or ideas, that you understand that all these play into one another, especially when you're working in the mental health field. And again, it comes down to being mindful of all your environment and circumstances. All right. So again, I've been utilizing this phrase quite a bit, and applying these approaches to case management. It's imperative that we are mindful, and mindfulness is the basic human ability to be fully present, aware of where we are, what we're doing, and not overly reactive or overwhelmed by what's going on around us. Being mindful as it pertains to the application of what role you play and what points in time, it's imperative your entire thought process is engaged in that moment. It's vital to understand when and what application is necessary and in which to apply. A member who's in crisis may require someone to apply all forms of methodologies to not only assist them through this time of great need, but will also help you gain the insight needed to report back to your supervisor and or medical team or other stakeholders. If the member is making comments about harming themselves, for instance, and they have no history of doing so, this may require an ability in which you apply all methodologies while also being present enough to bring into the matter a supervisor or coworker to share in same time communication in the event that the person requires immediate attention and they're resistant to any and all recommendations being made. Handling crisis situations will be another component of training you'll be provided in the future, but knowing these forms of communication and how to practice them will serve as a great foundation in your work. You're gonna come across a great deal of situations that are gonna come up, especially with individuals who are in crisis at that moment in time. That crisis could be something insignificant as far as how you're perceiving it, but it's important that you erase that mentality, that you stop seeing things as not important, because for that person, for that member who's experiencing that crisis, it's very much important for them. So when you're handling crisis situations, you want to be able to be in that moment. You want to be mindful, first of all, not to respond unfavorably, where it kind of detracts from the member or distracts the member and makes them feel they no longer have that safe environment in which to share and no longer feel they can trust you. But at the same time, bringing in, and again, I mean, you're going to find and working in this field that it becomes pretty much second nature. One example I utilize a lot of times in working in this field, there was a member that I'd been working with, and he asked to speak to me in private. And speaking to me in private, he indicated that he was feeling suicidal and he had a plan. And the plan that he dictated to me was basically he was going to fill up his bathtub, grab a couple of extensions so that he could throw his plug in his toaster and throw it into the water while he's in the water. Now, at that moment in time, I've offered a wealth of recommendations or offered him different ideas on how to cope, even tried to redirect him. But at that moment, he felt very safe enough to let me know that, it didn't matter what it was going to take. He was feeling this and nobody could take that away from him. So as I'm engaging him in dialogue, I'm bringing him now. The idea now is because he's shared this information in private and there are no witnesses to hear this information, I bring him to the pod, basically having a casual conversation as we're walking back to where all the other case managers are sitting. And it's at this time where I reintroduce the conversation. And in reintroducing the conversation, again, he's in that safe place in sharing. He again reiterates exactly what he told me when we were in private. A lot of the case managers were very tuned to what was going on, and the two case managers that were very seasoned caught the information, were listening, and as they were listening, it was at that point that one of them not only joined our conversation to try to assist with redirecting him, which was vital because he also had a good rapport with this case manager, and it was now two individuals working with this one member. But the second case manager made it a point to staff with our doctor, to which the doctor had agreed that we needed to file an immediate petition. And from there actually went to Community Bridges CPEC, which is located in Mesa, and completed the petition, in which it was accepted. The member was picked up later that evening and was placed on court order treatment. Now, you know, sometimes again, this basically comes down to being in the field long enough to know exactly how to approach these things. But if you have no idea in which how to communicate and how to utilize these elements of communication so that you can then get that individual the necessary help they need, then, you know, again, it defeats the purpose, because your job here is to try to help these individuals who are experiencing crisis, who are living with a serious mental illness, to come to terms, to cope, and to fulfill a better quality of life, if you will. So again, I can only hope that you guys continue paying attention and build up these skills in these areas. Now, again, going back to, if we go back to one of the slides when we were talking about reflective listening, I also discussed at that point motivational interviewing. Motivational interviewing was a concept that was actually created by Stephen Miller, and I believe, I can't remember his first name. Miller and Rolnick were the individuals that actually created this concept. And basically it was to intervene and assist individuals who were in this cycle of change. And I utilized this slide and actually added a picture in which goes through the cycle of change that you will be dealing with. And these individuals are again, pre-contemplative state, which are individuals who don't feel, whether it's substance use or their mental illness or what have you, they don't feel that these behaviors have to be addressed. There are no issues. And they really, you know, again, there's no regard for it. Then you go into the next stage, which is contemplation, in which the individual is now actually contemplating, wow, maybe this is a problem. Maybe I really do need to look at this and you know, study this and maybe make better decisions for myself. On to preparation, where the individual is now actually coming up with ideas, or actually open to ideas that are being provided to them, so that they can start evolving and so they can start progressing in the decisions that they're making, which rolls right into action, meaning that the individual is then involved in some form of action, whether it's engaged in treatment, engaged in you know, attending AANA, for instance, or what have you, and following the 12-step program, or maybe they're just, you know, now finally listening to the doctors and taking their medications as prescribed. And then finally you go into what's called maintenance, and that's basically where the individual is now at a place where, you know, they feel comfortable. There's one stage that's actually missed in this cycle, and that's the cycle of relapse, because again, one thing that we learn in working in this field is that relapse is inevitable. It's going to happen. And we hope that it never happens to individuals, whether they're dealing with a mental health crisis and they stop taking their medications, or individuals who are using substances and suffer a relapse. But again, we want to continue that this cycle of change continues to help them evolve in their treatment. And basically what motivational interviewing does is It's a psychotherapeutic approach that attempts to move an individual away from a state of indecision or uncertainty and towards finding motivation to making more positive decisions and accomplishing established goals. So again, if you can see how this cycle then works with one another, and how motivational interviewing is vital in helping individuals jump from each stage. It plays a great role in your position, and you're going to see that it's a tool that, when utilized well, really does help individuals sustain that change. Oftentimes when they're being forced to make changes like court order treatment or mental health probation, these individuals, they could give a damn about anything but where they are in their life, and they don't care about courts. They don't care about who's telling them. Authority can't tell them what they're going to decide. So oftentimes when they're being forced into a situation, you can still utilize motivational interviewing, which is a beautiful thing. But oftentimes when they're not motivated, or they have no idea or presence of mind to realize their need for services or treatment, utilizing something like motivational interviewing can help them, make better decisions in themselves. The one component about motivational interviewing that's important for you to understand is this is not a decision that when they're making decisions for themselves, you are not trying to address them making the decision that you want them to make. It's imperative that they're making the decision that they want to make. So, and there's a difference with that. Oftentimes they may be making a decision on something and you don't agree with it, but at that moment in time, they need to make that decision for themselves. And hopefully, if it is a bad decision, they'll learn from it. Kind of just to discuss motivational interviewing a little bit more in detail, it differs in that it utilizes a non-confrontational collaborative effort between a therapist and client to spark motivation and initiate change. It becomes a dance, if you will. It becomes you and that individual becoming part of this dialogue, but you're not judging them. You're not combative with them. You're basically in a dance, and the dance becomes beautiful to watch, because when there's a rhythm with that dance and the member is not so much making, again, decisions that you want them to make, but they're following the rhythm of that dance and the dialogue that you're having with them. Again, it becomes something that is fulfilling for the case manager. Rather than inciting any antagonistic or combative ways, the therapist engages with the client to explore his feelings, including the ambivalence about changing, and helps the client find his or her own motivations. The therapist becomes a person of support, allowing the client to make their own choices and arrive at their own conclusions without feeling outside pressure to do so. Again, I mentioned MI as part of communication, as well. It's going to play into your progression as a case manager. And you will be provided more extensive training in this area to help you build up your toolbox. But again, I wanted to touch on this because this is a form of communication that we do utilize here in the behavioral health field. Okay, so for many of you who've worked in the field, you guys know that what governs our services is basically what's related or what's relayed in the assessment and the treatment plan. And the assessment is basically the process of obtaining information about the patient's mental health treatment that often includes a biopsychosocial view of the member's history. This also includes a drug use and how it's affecting his or her life. It's an essential part of treatment and care for people who are in services. Treatment planning is the process of obtaining treatment goals from the members seeking to achieve outcomes that will enhance their quality of life. Assessment and treatment planning, as you all know, governs the services that are being provided to the member and is necessary in accordance to the covered service manual and access. For the purpose of effective communication, we're just touching on this to mention another element of your progression as a case manager moving forward that will require great skills in the areas of communication and engagement. For a lot of individuals, assessments and treatment planning is quite easy. There's an interview process that a lot of clinics or a lot of agencies have formulated and perfected over the years. And working with our company, I can tell you that our assessment process is actually is very easy for those individuals who are just opening up a comprehensive assessment in NextGen, for instance, and is following everything verbatim. What you're trying to do is you're having a dialogue to capture as much information, but if you're reading the questions verbatim, you don't allow yourself the opportunity in which to build rapport and effectively engage with that member. I've learned to pretty much memorize most of the questions. And what I've told case managers working, over the many years I've worked in this field, whether I was a clinical coordinator or working as a case manager, is I'm always discussing or assessing the individuals when I'm meeting with them one-to-one. Depending on what team I'm working on, most of my experience has been working on assertive community treatment teams. So on an ACT team, we actually have a longer period of time in which to engage with members. Oftentimes this can be a 2 to 4 hour engagement. And as you're meeting with the member, you're getting a lot of information from them during these 2 to 4 hours. For supportive and connective level of care, which is your lower level of care, you may have individuals that are there engaged with you for 5 minutes, and you may have an individual there that's willing to chat with you for 30, 45 minutes. But again, you always want to capture as much information as possible when you're meeting with the member. And again, recognizing those nonverbal cues. Individuals, for instance, their dress and their hygiene. If an individual is again, I hear the term, utilized a lot, malodorous. Again, if their hygiene is poor, if they haven't showered, and that's evident because they have caked on dirt on their hands and fingernails and what have you, their clothes are soiled. Again, it's visually seeing that member and assessing that individual, and that kind of gives you a snapshot as to how well that member's doing. Homelessness is a big situation that we contend with, working with individuals with mental illness. We don't, to say our clinic, I think our clinic probably has about 5%, maybe even less of individuals who are homeless. Oftentimes, homelessness could be for many reasons. Maybe it's by choice, and they would rather have their Social Security money to themselves rather than, having to pay their entire check on rent. Or maybe they just don't like authority. They just don't appreciate authority, and they're not going to listen to anything authority tells them, in the sense that, the police department or the greater society says you need to be housed to be normal. These are individuals that say, I am normal. The way I feel, the way I think, the way I believe, I do feel I'm normal, and nobody should tell me what to do. But again, it's understanding that when you're meeting with these individuals, you're assessing this information. You're gathering that information by what they're saying, how they're presenting, what they look like, what they smell like, utilizing, again, as many instincts and observations as possible. But again, assessment becomes part of your toolbox. If you're an effective case manager, each and every time you're meeting with that member, you should be assessing that member at all times. And this way it makes that assessment component easier for you. People often, because I was a clinical coordinator for many years for both supportive level and ACT team levels of care. But I can easily memorize, because I really do pay attention to the members I work with. I can tell you, if you give me a caseload of 100 or you give me a caseload of 250, and supervising, the case managers I've supervised, if you provide me with clear and consistent information and efficient information, I will know these individuals. I mean, if you interview me, and I've proven this time and time again in working in this field and having been audited, I'll tell you every presentation, the presentation of this member, what they're dealing with, the issues that have marked barriers for them or have been challenges to them. And basically I can tell you, what medication's been working, what medications haven't been working, what treatments have been offered, if the member has been receptive to treatment, where the member is at that point in time. Do they have a spouse? Do they have a support system? And again, and being able to not only identify that information for each and every one of your members. And for case managers, the luxury of that is you only have to get to know a few select members. If you're on an ACT team, your responsibility is as much as the clinical coordinator's responsibility. You got to know 100 members on that caseload. So again, if you pay attention and you're listening to your teammates and you're gathering the information and you're able to at least put a few things together, you know that member, you'll always know what that member is experiencing and how to best assess them. Also, if you write a great assessment, that's also captured in the documentation that you provide, not only in what's known as progress notes, which we will finish this presentation with here shortly, but also in your assessing of them and when you're completing that initial assessment. And again, the luxury of that is getting to know that member, engaging that member and really getting to know them. And again, treatment planning is that opportunity for that member to really take hold of their treatment and say, man, you know what? I think I deserve a better life. I think I do want a better life. And I think this is what the better life looks like for me. And if you can be the individual to help me achieve that, then you know what? I'll follow you. Let me see. But again, as a case manager, you always have to be the one to say, no, sir, no, ma'am. I got to put you in the front. I'll walk with you, but I'm not ever going to guide you. That's going to be something that you along the way, you're going to have to make better choices and decisions for yourself, but I will be there every step of the way. And I'll give you your varying options so that you know what the boundaries are and when to cross those boundaries if that's what you feel you need to do. Assessing crisis. So again, this is part of the court order process, assessing individuals or court order evaluations process. And this is coming verbatim directly from the covered services manual. But when we're assessing crisis, and then this is an important component of communication, we're listening to what they're saying, we're measuring what, when, and how of the issue, we're talking to these individuals and we're engaging these individuals because we want to help. At the end of the day, that's exactly what we're there for in a crisis system, is to help these individuals achieve some form of stability or healing. The elements that I want to really look at are when we're assessing crisis, and this is, not only when you're taking in information, but also reporting back information to the BHMPs and medical personnel or your clinical director or your clinical coordinator or what have you. You want to be able to utilize the appropriate verbiage so that it becomes pretty much second nature for you. When you hear these terms, you know what people are talking about. Assessing crisis basically is assessing those individuals who at some point during the topic of conversation that you're having with them have been determined to be a danger to self, a danger to others. They're persistently and acutely disabled, or they're gravely disabled. And basically, to break down these things, a danger to self is someone who's experiencing thoughts of wanting to harm themselves in the form of suicide. Danger to others is those individuals who are making claims to want to harm or hurt others to the point of murdering or killing them or severely impairing them. Persistently and acutely disabled are individuals. This is not an emergent reason for you to file a petition, but in filing a petition for these individuals, these are individuals who have very little insight or have clearly no insight to take care of themselves. And this is why, and again, homelessness is not a PAD reason. I'm looking more of individuals whose hygiene has always been impeccable and they've always been taking care of themselves. And all of a sudden now they may be urinating on themselves or defecating on themselves. They don't take showers regularly. Their hair is matted and they got stuff on their hands and fingernails, or they're sleeping out in the elements and not being safe, or engaging in inappropriate sexual behavior, risky sexual behavior, things of that nature. Again, but these are individuals that when you do get them the treatment that they need, they are able to snap out of it once they get the medication that's required. And then finally, gravely disabled are those individuals who are so severely impaired that they require a guardian ad litem or an individual in which to make choices for them in regards to their care, even whether it's during the time that they're on COE or COT or what have you. If the guardian ad litem feels that this individuals would benefit from a guardian, at that point they would go ahead and petition the courts so that they can get them the appropriate individuals to be their guardian. But taken directly from, I want to read this portion of it, taken directly from the Covered Services Manual, because I need you guys to understand the communication aspect of what it entails. But at times, again, reading directly from the Covered Services Manual, at times it may be necessary to initiate a civil court action to ensure the safety of a person or the safety of other persons due to a person's mental health disorder when that person is unable or unwilling to participate in treatment. In Arizona, state law permits any responsible person to submit an application for pre-petitioning screening when another member may be as a result of a mental disorder. Pre-petition screening includes an examination of the person's mental status and or other relevant circumstances by a designated screening agency. Upon review of the application, examination of the person, review of other pertinent information, a licensed screening agency's medical director or designee will determine if the person meets criteria for DTS, danger to self, DTO, danger to others, PAD, persistently or acutely disabled, or GD, gravely disabled as a result of a mental disorder. If the pre-petition screening indicates that the person may be DTS, DTO, PAD, or GD, the screening agency will file an application for a court-ordered evaluation. Based on the immediate safety of the person or others, an emergency admission for evaluation may be necessary. Otherwise, an evaluation will be arranged for the person by a designated evaluation agency within timeframes specified by state law. Again, I want to remind y'all that you will be receiving more extensive training in this area in the next few days. Practicing your skills in the areas of communication is going to better assist you in knowing what it is you're evaluating for, how to redirect a member if they're able to be redirected, and then how to effectively communicate your observations to the providers, to the clinical director, clinical coordinator, to the doctors, to the nurses, and also capturing that information so when you put it in the actual petition, it reads the way it needs to read so that other individuals could then get the information and receive the information to make the best decision they can to either move forward with that petition and bring in the individual for court order evaluation, or drop the petition. And oftentimes, that does occur when there's not a lot of consistent information being shared in these petitions. Oftentimes these petitions get dropped. Again, COE petitions, when it's determined there's a reasonable cause to believe that an individual being screened is in a condition. I believe we've pretty much handled that in the last slide. Once a person has been deemed COT and they are danger to self, danger to others, PAD, what have you, the communication that's important that you will have to be responsible for is what's called the COT status reports. Court orders based on gravely disabled and persistent acutely disabled may be extended into an annual examination renewal. If the renewal of the court order is sought, the court appoints the legal counsel to represent this person. This person requesting a hearing on the requested renewal, the person seeking the renewal of the order must then prove by clear and convincing evidence to the court that the person continues to have a mental disorder, that they are in need of continued treatment, and they're unwilling or unable to accept voluntary treatment. So again, once a member is placed on COT, the courts mandate that the contracted agency and appointed case manager provide quarterly reports providing updates on the progression or regression of members being served. Keeping these records is vital for case managers to ensure that the court order is upheld and to further ensure that the agent is keeping track of the member. Part of these requirements of COT are that the member has to be making all their monthly appointments as well as following all medication recommendations being made by the prescriber. If it requires a long-acting injection, then the member is required to attend those appointments as well. Reporting this information to the courts during the COT process provides the agent attention to detail and communicate. Process provides the agent to seek an extension or renewal for the COT if the member requires it or further proves that the member can do well when they're consistent with medication regimens or completely engaged in their treatment. This can only be possible by your attention to detail and communicating this during the reporting process and when sharing with the clinical team so that the medical team and case management team can make better informed decisions in the matter of treatment for this individual. So again, effective communication, keeping records, making sure that you're documenting everything. If it's not documented, it never happened. Always follow that ideal. It has been an ideal that I have followed for many years in working in this field. Finally, the last part of communication that's very vital in working in behavioral health is that of documentation. Basically, documentation, for those of you who don't know, or those of you who probably do know and don't know how to explain it, progress notes. So basically what progress notes are, they're an ongoing record of a patient's illness and treatment. It's either physicians, nurses, consultants, case managers, therapists recording their notes concerning the progress or lack of progress made by the patient between the time of the previous note and the most recent note. In patients who are not critically ill, a note concerning progress may be made daily or less frequently. For patients in critical care, notes may be made hourly. It's important that each note be written clearly, the date and time recorded, and the note is signed. Often it's electronically signed if you work with an electronic health record like we do. Also, part of the medical records are contact notes, and which you are noting all the times in which you're coordinating care with the stakeholders in the community. You will be representing yourself as an expert and professional on your member, and will be speaking with hospitals, courts, social service agencies, therapists, family members, community advocates, amongst the many individuals that may or may not be involved in this member's care. These records are not only important for billing purposes, but are also indicative of your work as a case manager. The more organized and detailed, the better. It's also something to note that often your notes could be subpoenaed by the courts, and if your work is questioned, your notes will be able to verify your efforts. Documentation requirements are very strict and are governed by the company and the REBA. The policy is that all notes should be in the system within 24 hours and should not go longer than 72 hours to be entered into the medical record. Depending on what agency you work with, there are many different ways of documenting notes. Some have heard of the SOAP version. Some have heard of the RAP version. I prefer the RAP, which is basically documenting the reason, the assessment, the progress, and the plan of an individual, and basically documenting all four of these areas. So again, it depends on the individual and what they prefer to use. But again, it's vital that when you're documenting, you're capturing as much information as possible. And this is also for your own well-being and safety. You want to make sure that, if somebody's questioning your work, you've captured that information efficiently and consistently in that document. So I just want to end this by welcoming everyone to our company. You've been selected for a reason as a case manager, and I think that whoever completed the interview felt very strongly in your abilities. So we look forward to working with you. But again, I want you to leave here knowing how vital and important it is for communication within our field is to us. So communication is vital in this field and in the work you've been selected to perform by our company. Our efforts here are not to scare you, but guide you so that you're completely aware and adequately trained to meet the needs of your position. For continued mentoring and coaching, we ask that you continue to go to your supervisor, any clinical coordinator at your campus, as well as contact us with any questions or barriers you may run into. Again, welcome to our company and to our team. I hope you enjoyed this presentation. If you have any further questions, please feel free to contact me. Once again, my name is Hector Duran. Have a good day.